certified naturopath and medical herbalist. And I am also a advanced hemaview practitioner. I'll explain a little bit about that later on, okay? It's something, it's a special test that I do within my consultation, but it's all to do with the blood, and I can show you what that looks like when we're dealing with immune system dysfunction later on, okay? So I've been in practice for 3 years. This is my 4th year coming up, and I've seen a lot of people with chronic immune system issues. So who here actually is here for themselves? Who's getting sick all the time, or who's experiencing long-term or chronic immune issues? None of you guys.
Don't want to get sick.
Don't want to get sick. That's the best way to go, because you want to be preventative more than anything. A lot of people tend to get sick quite often, especially the younger people these days, and they'll experience, going to work and find themselves among all these other sick people during winter, and they get sick and they just keep passing it on to each other. And it's nice to share about certain things you want to keep to yourself, right? And a lot of people also get too busy to actually focus on the immune system, so they force themselves to go to work, and guess what? You just start spreading it everywhere, don't you? Yeah.
Well, you're also running your body down as well.
Absolutely, absolutely. We drive it to the ground, and we'll also talk about some of those things tonight. How stresses and the responses that your body takes on during stress, and how it affects your immune system. So I'll be talking about all of those things. Okay. Might have something a little bit there. Okay, so we'll get things started. So just some of the basic things, yeah? Let's talk about some of the symptoms that you get. So we get things like headache, fever, runny nose, coughing, yeah? And you might also get a few other symptoms or concurrent conditions that might come along with colds and flus. So the things that colds might eventuate into as well will involve, your lymph nodes flaring up. Have you guys noticed that when you get sick sometimes? Yeah. I know I do, and it's one of the things that I look out for. It's just a little bit across here. When it's tender to touch, you'll feel a little bit of bean-sized lymph node popping up, yeah? And that's actually your immune system trying to do the job, okay? Sinusitis, so obviously when you have colds and flus, you get the blocked nose, yeah? And sometimes that can lead to localized infection around your sinuses. So up your nose, around across here, underneath your eyebrows, and across your forehead. And quite often when you press down on it, it's a bit painful as well, yeah? So it can lead into those kinds of things. Ear infection, obviously, because that's all connected to the ear as well. You can feel quite blocked up in your ears. And of course, things like pneumonia and bronchitis, yeah, leading into chest infections. All right, now some of the culprits of the infections that we experience, obviously viral infections. There are over 200 different viruses, yeah, and it can cause, and most of them can cause the common cold type of symptoms. Now, they look like this, or sometimes like this, yeah. So they come in a few different shapes and sizes. Examples will be things like rhinovirus, so very common for common colds. And it multiplies around the temperatures of 33 to 35 degrees Celsius. Now, do you guys know our rough normal body temperature?
37.
Yeah. So anywhere between about 36.5 to 37. Obviously there can be a little bit of variance between people, but when you start getting into the 35s, that's when it alerts to me possible thyroid issue there, because your body's responsible for looking after your body temperature. Yeah. Now, I'm talking about basal body temperature, not your normal temperature while you're awake. This is the temperature that you take first thing in the morning. So before you do anything, you open your eyes, you reach for the thermometer, you take a temperature, and that is your basal body temperature, okay? And you track it for about a month if you're a menstruating female, for about 2 weeks if you are postmenopausal, or if you're a male and not going through menstrual cycles, obviously, because menstrual cycles will create an up and down motion in your temperature. Okay. And quite often, people with thyroid issues will have recurrent infections because their temperature is so low. Yeah. So that's something to note. Other ones are like coronavirus, respiratory syncytial virus, influenza, and norovirus and rotavirus. Those are more of those 24-hour stomach bugs. Yeah, have you guys come across those before? Haven't heard so much lately, but last couple of years I've seen an emergence of those, just people having that one very strong attack of vomiting, diarrhea, nausea, yeah, and it just disappears magically the next day. So those are some of the culprits there. And other ones are bacterial infections, which tend to be less common for common cold type of symptoms. But obviously you get things like strep throat type of infection. This one here, it's not the influenza that you're thinking about, but it leads on to things like pneumonia and meningitis. The symptoms could be fever, chills, cough, shortness of breath, chest pain for the one that causes pneumonia. For meningitis, though, you get things like stiff neck, quite bad headaches, nausea, vomiting, and sensitivity to light. Yeah, these are some of the symptoms that you can experience, and especially for children, it can be a little bit hard to pick up. And there's been cases where they would go to the doctor or other health practitioners, and they mistake it as a common cold or something else that's not as serious, and they end up with some type of brain damage, or sometimes even worse, death. Yeah. So it's really important to note these kinds of symptoms so that you're aware of it and you can see it in other people and in your children if you have children. Okay, and a few others here and there. This one here, Moraxella catarrhalis, that one causes things like otitis media, which is a bit of ear infection or swimmer's ears, bronchitis, sinusitis, laryngitis. So a few different culprits there. What do you think that we get sick? There's a lot of different aspects of this, but one of the things that is quite important to consider is your environment. And schools, workplace, airplanes, hospitals, poor housing, all of those things definitely contribute. Particularly where there's a congregation of large population. So schools, obviously, I mean, that's a given, right? We have kids running around, coughing on each other, spewing on each other. That's basically a cocktail for developing colds and flus. Workplace, obviously, you have air conditioning that circulates everything around the whole building, right? Airplanes, a great incubator for bacteria. Yeah, and you're stuck there for a long time, aren't you? Yeah, and the person next to you, you don't even know, might be coughing onto you as well. And poor housing, things like leaky homes or damp houses are often high in dust or dust mites or molds. The spores that they release into the air as well can definitely congest your upper respiratory system, and increase the risk of things like fungal overgrowth in your body, which will make you susceptible to infections as well. And hospitals is one that I noted before as well, and in 2011 there was estimated 722,000 healthcare or hospital-associated infections in US alone. And additionally, about 75,000 patients with these died during their hospitalizations. That's a huge number. That is huge. And it's not that they're not looking after the facilities properly. Sometimes it is. You know, poor facilities in hospitals can definitely be a factor. But quite often it's because you have a congregation of sick people all in one building. Yeah, it's quite scary when you see the figures. I don't know what the figures are in New Zealand. When you think about it, our facilities are not that great compared to some of the other more developed worlds. So I would be interested to see what the numbers are. But when you consider this, it's about 1 in every 25 patients, yeah, which is kind of scary. Yeah, that's a high chance. Now, we also have the physiological and mental stress as well. This is a big one, a huge one for people these days, yeah? We're so busy with our work, with our university life. University life is probably one of the worst things you can do for your health, by the way. And that's why a lot of younger people get sick. And we've got here a meta-analysis. Now, this is a congregation of a lot of different studies altogether of about 30 years of inquiry, so long-term study. Chronic stresses were associated with suppression of both cellular and humoral measures. Now, cellular and humoral are different types of immune systems that you have in your body. There's a immune system that works immediately, okay? That if you're exposed to some pathogens, your immune system deals with it immediately, okay? Now, there's also, more particularly with things like viruses, and this is where the concept of vaccine comes in, is that your body actually needs to learn how to deal with those particular viruses so that next time you get that same strain of virus, you are fully equipped to deal with that, yeah? And that's why when you move into a new area, you might not be fully equipped, you get exposed, you might get a little bit sick, yeah, more often, and then eventually your body builds up to it. And that's if you have a good working immune system, it is able to adapt, right? But when you consider sort of acute and chronic stress, we've got two different scenarios there, okay? Now, acute stress. Say if you come across a tiger, okay? Have any of you come across a tiger?
Only in the zoo.
Yeah, only in the zoo, behind a nice big strong glass wall, and you know you're safe, right? So you're probably not under stress, you're more fascinated and excited than anything. But long time ago, we come across a tiger, there was no big glass wall between us. So you fall into what's called a fight or flight mode. Yeah, you guys heard of that?
Mm-hmm.
So what fight or flight mode is basically a change in your body, yeah, the function of your body, yeah, so that you are more adapted to fighting the tiger or running away from the tiger, yeah. Very different from what's called rest and digest mode, okay. Now, rest and digest mode is when you're nice and relaxed, yeah, and when a lot of background physiological function happens, but the two cannot exist together. Yeah? So you're always in either or, okay? Now you come across a tiger, basically what happens is a lot of your blood gets shunted away from the center of your body, which is, you know, your gut, your liver, your kidneys, etc. Yeah? Goes into your muscles, okay? You tense up, you're ready to run, yeah? Your blood pressure goes up, your blood sugar level goes up, yeah? All the things that you need to make a very fast decision, you do something physical. Your heart rate also goes up, yeah? And the blood also goes to your brain, your eyes. Everywhere you need for keen senses, yeah? All of those things happen for a reason, for survival, okay? Now, that happening in that situation is totally fine. And if you come across a tiger every 6 months, totally fine. In fact, it's healthy for you. It keeps you ready.
On your toes.
Yeah. But let's say you come across a tiger every single day at work, right? You are
Happens for some
constantly
people.
under stress, and you fall into what's called now chronic stress, and that's the type of stress that we all experience these days. Yeah, stress from work, stress from family things, stress from your
Traffic.
yes, traffic. Yeah, a lot of things around us are causing stress, and so when you're constantly in that fight or flight mode and unable to fall back into the rest and digest mode, then your body starts to get used to that. Yeah, it starts to adapt. And now all the things that were working in the background, like your immune function, your digestive function, you know, and your hormonal balance, all of those things gets neglected because you're in survival mode. You don't need to digest when you're running away from a tiger, do you? You're not gonna go to the bathroom and just do your business while the tiger is right behind you, right? You don't need to do those things. Same as your immune system. If you have a local infection, you don't need to deal with it at this point in time. You need to run away. Yeah. So if you can imagine when you're chronically stressed, your immune system goes, yeah? And that's why I see a lot these days. Yeah. And that is usually the main cause of chronic immune dysfunction. Yeah. So constantly getting sick, or each infection lasting a long time. Now, how many times do you guys think is appropriate to get sick per year?
No.
3 times.
3 times? None? Any other figures?
Once a year I
Once.
normally hit.
Okay. Ideal number is none. Now, you do get those situations where it's sometimes a little bit unavoidable, but you know, I've known people who's gone 3-4 years without getting sick at all. Yeah.
I mean, you'd expect to get sick at some point in your lifetime because
Oh, you will. Yeah. You will. And you need
But
to,
you
especially
don't.
when you're younger.
Yeah.
Yeah, you're developing your
Yeah.
immune system.
Mm.
Yeah. But right now, I ask a lot of people this. I say, hey, so do you get sick often? And they say no. And I always ask, okay, how many times do you get sick a year? 3-4 times. Too much. Yeah, there's something going on there. So that is not ideal. It may be normal when you compare it with the rest of the population, but it's not ideal. Yeah. Other things that can affect your immune function is things like diet and lifestyle. Yeah. So low nutrients is one of the other things that I see quite often these days. Now, one thing that I do need to note, in New Zealand, our soil is quite low in a lot of minerals. Yeah. All of these things like zinc, selenium, magnesium, iodine. Yeah. And vitamin D, because we have issues with UV rays that we protect ourselves from the sun, and quite often, yeah, and
it's really bad if you get low in vitamin D.
Yeah, absolutely.
Sunlight with no sun.
So these are things that you can find low in our local foods, yeah, but also the food processing that we go through these days, our agricultural system, has stripped away about 30% of our nutrients compared to about 40-50 years ago. 30%, that's a huge amount, yeah? And so we're losing more and more nutrients from our foods. And that's why I usually encourage things like organic foods, yeah? They are better in terms of the nutrients that you can get from it, yeah? One thing that I will also note is that, you know, the skin of your fruits and veggies, yeah, that's where a lot of the nutrients are, and a lot of people strip that away. You know, I eat kiwi fruit with the skin on it. Yeah, people like, you are
Me
weird.
too. I know,
Yeah.
I just humping to people, what
Yeah.
are you doing?
I know, they freak out. I don't do that with oranges, but, you know, apples, sure. I don't peel the thing,
No.
you know? Keep the skin on, because that's where a lot of your antioxidants are, yeah? And here's another thing. A lot of our foods used to be different. Carrots used to be white or purple, yeah, not orange. And they didn't used to be sweet. Neither did apples. They used to be bitter, not sweet.
Wow.
But because us as humans, yeah, we like sweet things. We're biologically trained because fruits and things like that, something that was sweet, used to be a scarcity. Yeah, it used to be scarce. So when we come across it, we we keep it somewhere safe and we have it every now and then. Yeah, and it was a delicacy. Yeah? Now it's so available because those marketers know something sweet is addictive. Yeah, and I can guarantee you, when a lot of people come and see me with sugar issues like sugar cravings and things like that, you go off sugar for about a month, give it 5 weeks maybe, your palate will start to change. Yeah, we have Sarah comes to see me. Yeah.
How could you resist for 5 weeks?
Everything tastes so sweet when you go back to it.
Yeah, and it's too sweet, isn't it?
Salad dressing.
Yeah. You have an ice cream and you're just like, whoa, that is too much.
A milkshake.
Yeah.
I couldn't drink it.
Exactly.
I had to throw it away.
Yeah.
And I asked them to tip it out and put more milk in it.
Yeah.
Disgusting.
And I had a patient who was a young Asian girl, and she was actually scared that she no longer wanted sugar. I told her right at the beginning, look, I said, if we start this, we're going to see that you're going to want sugar less. Yeah, you're not going to crave it anymore. And she was genuinely sad. I was like, oh, but I like sugar. I was like, but I know, but you wouldn't want it anymore, and you'd like other things that are more healthier for you. And she was just this close to crying, right? Now I see her and I say, how are you going? And she's like, good. I don't want sugar anymore. I was like, how do you feel about that? It's like, great. Yeah. And she's sleeping so much better. Her menstrual cycles are so much better. Yeah. Sugar can do a lot of damage to your body. Anyway, sorry, I digress. Lack of exercise. Yeah, that's a big one. And I'll talk a little bit about what exercise does for us later down the track as well. Sleep, that's another one. When we talked about stress, yeah. You know how we talked about that chronic stress and always being on fight or flight mode? Yeah, that leads to things called adrenal fatigue or adrenal stress. Your adrenal glands are located on top of your kidneys, yeah, and they produce stress hormones, okay, things like cortisol and adrenaline, yeah. Cortisol is also anti-inflammatory, yeah, which dampens our immune function, okay. I'll talk about a little bit about this later on as well. When you have adrenal stress, it starts to affect your sleeping patterns, okay. You might find it more difficult to fall asleep. Yeah, so you might stay up till about 11 o'clock and you're thinking, oh, I'm not that tired, I'll just go on my laptop or on my tablet and read something. And also throughout the night, you might be waking up every now and then going to the bathroom. A lot of people think it's a bladder problem, but no, it's actually because you're waking up, your bladder goes, ooh, morning time, go to the bathroom.
Oh, is that right?
Yes. So not always, but quite often. Yeah.
Interesting.
Once we can get a good sleeping pattern going, you'll find that they'll just not go to the bathroom.
So what would you recommend for good sleeping pattern? Like how do you?
Good sleeping pattern.
Yeah.
It depends on where that's coming from, but if
Yeah.
it's adrenal stress, then obviously we need to address the stress that's coming in by working on the adrenal glands. So we work with things like adaptogenic herbs to bring your tolerance up for stress. Yeah. Calm you down, because a lot of people have anxiety. Yeah, bringing that down. Relaxation techniques. Also, sleep hygiene is very important. Making sure that you do the right things before you go to sleep. Yeah, no tablets, no laptops, no phones. Okay.
No sleep drops.
Sleep drops are good, but those bright lights will drop your melatonin levels, and melatonin is your sleep hormone. Yeah, because your brain thinks it's daytime still. Yeah. When you go to the bathroom in the middle of the night and you switch on that light, melatonin drops again. So it's difficult for you to get back to sleep after that. Okay. You want to also eliminate electronics away from your head while you're sleeping, because the electromagnetic frequencies also disturb your sleeping patterns. and making sure you relax and go to sleep before 11 o'clock, because after 11 a lot of people get another bout of energy.
Yeah.
All right, so those are some of the things that you can do. Sorry, I'm digressing again. Signs of low immune function, frequent and persistent infections, obviously. Don't respond well to medical treatment, so even if you're taking things like paracetamol, ibuprofen, things like that, codeine, you don't really respond very well. Things like vaccines as well, you might get sick straight away, or you might catch it anyway. So those are some signs of low immune function. And lack of fever, and I will also talk about this very soon as well.
Fever's your immune response, isn't it?
Other signs. Now this is getting to what I specialize in. Okay, so this something that I do is called HemoView, and HemoView is live blood screening. So during my consultation, I take a very small sample of blood from your finger and I pop it up onto the microscope and onto the screen, and I describe to you what's going on in your blood, yeah, and in your body. I don't use this as a diagnostic tool, and it should never be used as a diagnostic tool. It's a screening tool. So what that means is that the information I take away from it, I combine it with the notes that I take of the consultation that I have with you, so all the questions that I've asked, yeah? And I can't diagnose anything from this, but it can give some really good direction as to where I'm going with your treatment plan. Now, how that affects the way I see immune function in the blood, signs that we can see in the blood for low immune function is things like lazy neutrophils. Now, neutrophils are one of the most abundant white blood cells in your body. And it's these guys here. You see these round circles, white round circles? Yeah? All of those are neutrophils, okay? They're kind of like the first line soldiers in your body, yeah? Now,
Infantry.
yeah, basically, yeah. And when they are lazy, right, your body's not very well protected. And how I see that is usually, you see these ones here, they're quite nice and round, aren't they? Yeah? They're pretty round like that, yeah? That usually tells me that it's a bit lazy.
Oh.
Yeah? And I usually stare at it for about maybe 5 to 10 seconds, just to see if it moves a little bit. They do move slowly in the blood, and so if they don't move at all, and if the majority of your neutrophils are doing that, I'm thinking, okay, I think there's a bit of an immune issue here. Do you get sick often? Yes. Yeah. This also, I'll put here, what we call white blood cell cohesion. So this part here, you see a lot of neutrophils sticking together.
Yeah.
Okay. That means that the neutrophils, each one of them is not performing the job by themselves. So they have to team up with other neutrophils to do that job. Yeah. So that's another sign that tells me, better immune dysfunction there.
So how do you get them to move their
Yeah,
house?
so things like, I'll definitely discuss with you, but vitamin C is great.
Okay.
Yeah.
But don't they say that vitamin C, especially for women, is very hard to be absorbed?
I'll talk to you about that as well. Yeah, so it's, again, thinking about the forms of vitamin C and how much you give to that person as well. Yeah.
Is it something like too much?
You can have too much. You can reach what's called a bowel tolerance.
Yeah.
Bowel tolerance is basically the upper limit of how much you can take vitamin C without causing stomach issues. Yeah? Because you can start to get runny stools and a little bit of discomfort in there. So what I usually do, if you want to discover bowel tolerance, you go up to that level and you start experiencing, that feels a bit funny, you drop it down a dose. Yeah? And that is your maximum amount that you should be taking orally. Yeah? Obviously, much higher doses can be taken intravenously, but that's more for chelation, so heavy metal detoxing or cancer therapy. Yeah. And also young and old immune cells. Okay, so there's a certain maturity that I'm looking for in the neutrophils. Okay, so some of them are just old enough so that they're doing the job. So really think of them as soldiers. Yeah, you want them around that 20, 30s age, right? You don't want them to be 80. You don't want them to be 7, right? When you're thinking about
So
soldiers.
how do you know when they reach 20s?
Yes. So you see some of these here, and do you see some of the black dots in the middle? Mm-hmm. When you have about 3 or 4, that's a good maturity. That's when you're, that's the actual nucleus of the cell. So that's the brain center, although I don't like to call it that. But it's the nucleus of the cell. And as it gets older, it multiplies. Yeah. So 3 or 4 is a good amount. This one here has only 1. Yeah. That's a very, very immature cell.
That's a baby.
Yeah. And sometimes I see that after a very, very chronic infection, and your body has exhausted its mature soldiers, and now it's coming straight from the bone marrow, and it's way too immature to do anything. Yeah. And that's when I see, that's a little bit, that's a bit of a warning sign for me. Okay. And also you might see others with about 5, 6, 7 nucleus, and that's getting to, yeah. Basically,
do
old
they
people
die?
with mobility scooters. Sorry.
Oh, do they die?
Yes, you get the ones dying off, and then you get new ones from the bone marrow. Yeah, so it's a continual cycle. But if the body is not producing enough mature ones, then it might try and keep some of the old ones to make sure that it tries to defend the body properly. Types of pharmaceutical drugs, so pseudoephedrine, so things like Sudafed and Codrol. These are decongestants, so basically they shrink the blood vessels in your mucous lining, especially the nasal passage, and they stop some of that congestion in your upper respiratory. We got paracetamol, things like Panadol, so that relieves pain and fever. We also have ibuprofen, so it treats pain, fever, and inflammation again as well. And codeine, which is an analgesic drug that's derived from morphine, so obviously again taking away that pain. Now these are all the things that a lot of people reach for these days because they don't have time to get sick. Do you? You can't afford to take 3 days off work. Yeah?
Not when you, anyway.
Especially when you've run out of sick leave.
I
You
know
need to
what
keep
it's, what
running.
it is. It's about like you've got it's policy being driven
Exactly.
from the top, saying you can only have be sick for this long and you've got to be better and this.
Exactly.
Yeah.
And people judge you as well. Yeah. Oh, she's away all the time getting sick. Oh, she's not doing enough job, and that leads to the top of the company, and who knows what might happen. So people are afraid to take too many days off work, and Lord knows how many things you need to complete in a week these days. Yeah. So a lot of people reach for these things, but there's a consequence. So side effects of pharmaceutical drug. Pseudoephedrine. Cardiovascular stimulation. So it can lead to things like elevated blood pressure, rapid heart rate, and arrhythmias. So inconsistent heart rate. Yeah, those are some side effects. Not always very common, but certainly through chronic use, these things can happen. Central nervous system stimulation, so restlessness, insomnia, so sleeplessness, anxiety, tremors, hallucinations. These are all things that can be part of taking pseudoephedrines as well. And we also have interactions, and this is why it's important for me to discuss with patients about interactions. Natural supplements are not safe because they're natural, okay?
They're powerful.
A lot of people think it is, and it scares me. So things like this one here, interactions with other medications, like antidepressant medications, tricyclic antidepressants and monoamine oxidase. All of those things can interact with things like pseudoephedrine, okay? But when we think about herbal things, if we take, say, St. John's wort with SSRI, which is a type of antidepressant, that's a big no-no. Yeah, or you have to be very careful with it. You have to know what you're doing. But St. John's wort is readily available at a supermarket. Scary. And it shouldn't be that way. So those are some of the things that we're working on as an association, but those are things that you really need to look out for. Now, other side effects. Paracetamol, this one's a good one. Long-term use can cause gastric bleeding, liver and kidney issues, and asthma in childhood as well. This is not very well known, but it has been on the news quite a bit. Recent research has also shown that the use of paracetamol during pregnancy may increase the risk of multiple behavioral difficulties in children. Yeah, that's another scary thought. And you do want to try and be off a lot of medications when you're pregnant, unless they're completely necessary, right?
It's interesting because most of the time you'd think that paracetamol was that one thing that you could take.
Exactly,
That's
because it's so readily available, right? It's over-the-counter product, and that's why there's also been an increase of paracetamol poisoning over the recent years, leading to acute liver failures because people take too much. You shouldn't be taking more than 4 grams of it per day, but a lot of people think more is better, and because it's so readily available, they think, oh, it must be safe. If it's prescribed by a doctor, you might think twice, right? And you should also avoid taking paracetamol if you are on things like warfarin, other types of drugs that might be prescribed to you, even alcohol, all of those things. I've had one kid come in who had a really bad reaction when he took paracetamol and alcohol together, and it took him about 6 months for him to come right through the treatment. He just kept getting vomiting all the time.
You mean a child?
No, he was about 20, 21, yeah. He just had a party and
So,
had a
but
paracetamol
that's
at the
really
same time.
interesting because the general public, you wouldn't even think that alcohol and paracetamol together would be bad.
Exactly. The information that we should be receiving about drugs from the doctors, it doesn't happen. Now, when you go to other countries, it can happen. When you go to Japan and you get prescribed things, they will list all the things for you, and it'll have things like side effects written on there and things that you shouldn't take with it. Yeah, all of those things. You just don't get that over here. And you should be given because you are entitled to it. So if you do get anything from the doctors or from the pharmacies, ask for that information or come and see me. Either way, it'll work.
So it's not written on the packet then?
It can be written on the packet.
So small, you can't-
Yeah, and who reads those packets? You know,
But that's
it's just if you're given it in a sheet of paper,
Yeah.
say, hey, you need to read this, then you'll read it. But if it's on a packet and nobody says anything about it, who's going to read that, you know? And these are some of the other ones for ibuprofen. Obviously affects the gut quite a bit. Bloating, gasiness, diarrhea, constipation, dizziness, all of those things. Codeine as well, drowsiness, lightheadedness, shortness of breath, nausea, vomiting. The list goes on. So here's the part that I'm getting to. So cold and flu medications can also prolong infection. And I think you might have mentioned it slightly just before, but what it does is it reduces your symptoms. And your symptoms are basically signs that your immune system is trying to do the job. Right? So inflammation, your fever, mucus production, all of those things happen because your immune system is going, right, we're going to do the job, we're going to try and fix this thing in about 3 days. Give me some time. Throwing a paracetamol in there, what you're doing is you're putting out the fire. Yeah. You remember we talked about the temperature range that some of those viruses and bacteria lives in? Yeah. When you get it up to 37, 38, 39, that's when you have a fever. Yeah, it's your body trying to get rid of it. Yeah, throw in those medications in there. Yeah, you're basically telling your immune system you're not doing any job, any good job.
Need you, it's
yeah,
fine.
it's fine. We'll just reduce the symptoms and we'll just let the infection linger. Yeah,
So
and that's why taking those medications at a young age can be very difficult because this is the time that they need to learn how to deal with those infections. Yeah.
So what's
Now,
the alternative?
Sorry?
What's the alternative? Not to
So-
take paracetamol
Yes.
when you have fever?
Yes.
What do you do?
You let the fever be there.
Unless it gets to the dangerous
Yeah,
high part.
unless it gets to
Different.
40 and above.
Yeah.
Because I had 40.
Mm.
Mm-hmm.
Yep. For you, you can actually deal with a bit more, but for children, you have to be a little bit careful. Okay.
Yeah.
But you let the fever be there, and you support it with natural things so that you're facilitating the immune function rather than suppressing it. Okay. So some of the products that I give to kids really supports that immune function to just start building up the ability to deal with them properly. Now, I do wonder, and sometimes I ask this question, especially for children, if they were naturally birthed, so vaginally birthed, and also whether they were C-section, yeah, and whether they've been breastfed properly, yeah. Those are critical things for the baby to go through for them to develop their immune system nicely, okay? So those 3 questions are very important. Also, another question to ask would be, what was the pregnancy like? Was there a lot of stress during that time? Because if the mom is feeling stressed, yeah, immune system is going to go down, and it's not going to communicate well with the baby that you're trying to develop in your womb, yeah, and they can develop immunological issues as well, yeah. Also, things that they were taking, yeah, Paracetamol or even coffee, alcohol, those kinds of things. All of those factors affect kids and their immune function. So we need to dig into those things to see where it's coming from. But you know, even as simple as probiotics can really help the immune system of a child. And they also say painkillers containing codeine are actually ineffective, and this is a report from doctors, right? Highly addictive and harmful, and should only be supplied by doctor's prescription, and that's what we need because it's just way too readily available. Yeah. All right. So you might be sitting there, what can we do about this? So I've gone through all the problems now. Now I'm going to get onto the solutions, which I'm sure you guys have been waiting for. So here we go. 3 most important things: rest, stay warm, increase fluid intake.
Is that it?
Thank you. Good night. I'll see you next time. It's very important though, you know, and a lot of people forget about this. And I just wanted to drill it in there.
Okay, so why rest? Why stay warm? And why increase fluid intake?
Good question. So, rest is for your immune system to actually do its job, right? Because when you're on the run, we talked about the fight or flight mode, yeah? When you're constantly under stress, your immune system is not going to do the job. So actually allowing yourself to rest is going to allow you to bring those symptoms out, and you are going to feel crap, yeah? But just trust that your immune system is doing the job, yeah? And that's why rest is so important. And if you actually take some rest, 2-3 days, you know, give it a chance, yeah? It usually comes right as long as your immune system is supported properly, okay? If you don't do this, then you can really prolong that infection. And you know, some people say like, oh, like, you know, I got sick like a month ago, things are just lingering, I still got that cough or still got that sneezing going, and it's just not quite going away, yeah. Usually they haven't had a proper rest. And why stay warm? Because we want to make sure that you don't get cold.
Why not?
Because
We
it's
talked about that
viruses.
temperature, hey?
The temperature of the
Yeah,
viruses
the
are-
colder you are, the more easier, well, unless you go really cold,
And then
which
dead.
means you're dead. You won't have to worry about a cold. But you want to stay at a temperature where it's ideal for your immune system to work. Yeah? Stay warm. Hydration, because you're going to lose a lot of fluid through your mucus. Okay? You have no idea how much you can lose through that. And you want to promote that fever, which is going to cause a bit of sweating. You're going to lose a lot of fluids as well as some electrolytes coming through. So you want to make sure you're having, you know, daily, we all should be having about 2 liters or so. Yeah, depending on our exercise level, etc., how big and small we are. When you have a cold, you want to be aiming a little higher than that. Yeah, 2.5 if not a little more. Yeah, and things like coconut water does a great job of hydrating you.
Why?
It's got electrolytes in there. Yeah, natural electrolytes in there to help absorb the fluid into your cells properly. Yeah. Let's get into other things. Vitamin C. So, we know it works, and there's a lot of evidence behind it. And one of the biggest evidence behind it is what's called Cochrane Review. This Cochrane Review here, this might be of interest because it's accessible by you guys as well. Cochrane Review is something that accumulates a lot of data from a lot of different studies together and finalizes the conclusion from it, okay? And what it has revealed is that regular supplementation had modest but consistent effect in reducing the duration of colds and flus, yeah, which is great. And you know, vitamin C is just one of those things, and we all know it works, yeah. It's just, I'm going to get into more about the better forms of vitamin C that you can take and how much you can take as well. But this is a huge study, you know, it's a comparison of 31 studies put all together, and with about 9,745 people. So that's a pretty big and solid data right there. How much do we take? Yeah. Usually those tablets come in about 1,000 milligrams. Yeah. On an average, when somebody's going through a cold or flu, I usually recommend about 6 of those per day. Yeah. So 2 tablets 3 times daily. Yeah. That's a good average amount to take. That usually doesn't hit the bowel tolerance, but it's also high enough to do something about it. A lot of people take 1 a day or 2 a day. That usually doesn't quite do the trick. There are different forms of vitamin C. So this is where it gets interesting. Yeah. So a lot of products from the retail range will contain things like citric acid. Yeah. And that usually is the main form. Citric acid is not that great. It's not that absorbable, and quite often it's the one that can irritate your gut a little bit. Okay. The things that I look for are things like sodium ascorbate or calcium ascorbate. But what's even better is not just single one of those forms of vitamin C, yeah, but a whole different range of different types of vitamin C. So include the citric acid, include the sodium ascorbate, include the calcium ascorbate, yeah. Because what you want to do is get it close, as close as you can to the form that you would get naturally, yeah. Okay. Because in nature, citric acid doesn't exist on its own. Yeah? It comes together with other things. Yeah? And that's why a lot of products will also contain bioflavonoids that also enhances the effect of the vitamin C or absorption of the vitamin C, because your gut goes, oh hey, I recognize what that is. That's vitamin C. I'm going to absorb that in. If it's just citric acid floating by, I'll be like, what the heck is that? I'm just going to push that forward. Yeah? So those kind of things are important. Now, there are forms like lipospheric vitamin C, which is something that I kind of like. It's encapsulated in fat, basically. And so it bypasses the normal absorption of your gut, yeah? And it basically goes straight through the gut membrane, rather than the body needing to think about whether it's vitamin C or not, because it's absorbing it as fat. And once it gets into the bloodstream, it's released as vitamin C. So it's quite nice. You can get it from pharmacies. And
it comes in a liquid form.
Yeah, it's this snotty jelly sort of form that nobody likes. Tastes not so great as well, but it is a fairly good form of vitamin C, and it's usually sodium ascorbate, I believe. Yeah, so it's a good form, and it's highly absorbable as well. Vitamin D, again, is very important because as New Zealanders, we do tend to have, on average, lower vitamin D levels in our body. So food sources, you can get it from things like fatty fish, liver, egg yolks, yeah. And the benefits that you get from it is enhances your immune system's response to both bacterial and viral infections. Okay. Yeah, so it's great overall immune enhancer.
I thought it was good for your skin.
Great for your skin, yeah.
They say have a good dose of vitamin D.
Yeah, and great for your bones as well.
Get in the sun, yeah.
Yeah. And it modulates inflammation. So when I say modulates, it can enhance it or it can decrease it as well. It reads what your body needs to do, so that if you have things like autoimmune disorders, which is hyperactivity of your immune system, yeah, because your own immune system is attacking your own body cells, yeah. So in that sense, vitamin D helps to bring that down to the optimal level rather than being up here and attacking yourself. Yeah? So another great thing about vitamin D, like I said, bone support. Now, there's also things like Echinacea. Now, you might have seen some vitamin C products that combines Echinacea as well, okay? So Echinacea is good. Benefits are, it's anti-inflammatory. Depurative means that it cleanses your blood, yeah? And also lymphatic means that it helps with your lymphatic system, so draining of your lymphatic system, yeah? Your lymphatic system is another immune system, okay? It has these pouches to deal with debris and bacteria and things like that properly, and then it's processed out of your body, all right?
So, excuse me, Echinacea should be taken just when you have a cold, or is it something that you can take?
No, this is something that has been on debate for a long time. Echinacea can be taken long term to help support your immune function overall so that you don't get sick. But it's also great for acute situations as well in higher doses. Yeah.
So just like vitamin C, really?
Just like vitamin C, yeah. It's great for, yeah, long term and short term as well. Yeah, different doses though. Also supports other symptoms or other conditions as well with Echinacea, not just colds and flus, yeah, but because it's a great anti-inflammatory, an immune enhancer and immune modulator, that means that it can be used for things like autoimmune disorders as well. So reducing the inflammation and reducing that immune response. It's great for that.
So you could take it as a pill or as tea, because they have Echinacea tea?
You can have tea. Tea is very gentle, but you can have that, and it's very therapeutic, yeah. I sometimes prescribe it as a herbal tincture, yeah, which is not the nicest tasting thing in the world, yeah, it's quite strong, but sometimes I make it up. I make a formula for a particular person so that it suits what they need. So I might put a little bit of Echinacea in there, put a little bit of andrographis in there, which is another type of herb that's great, yeah, and I mix it up with a few things so that you have this potion all to yourself, yeah, and it works on specific symptoms that you might be getting.
And how do you take it? Drops or?
You can have it, usually you take about 7.5 mils twice daily or 5 mils 3 times daily, yeah. Acute doses can be a little bit higher, but those are the normal doses that you take, and you just take it like a shot, yeah, and you chase it with something nice so that you don't have to deal with the aftertaste.
So basically you can drink something nice after it. That's not going to dilute it though, or it doesn't matter?
No, it's fine. If you just have a bit of water or something like that, or coconut water, that's totally fine, yeah. Now it deals with things like cancer as well, and other respiratory conditions, skin conditions, because it's such a good wound healing, it's got wound healing properties. So you can see it's used for a lot of different things as well.
So what is adjunctive treatment?
Oh, adjunctive treatment is when you have cancer, you might be going through radiotherapy or chemotherapy. You can use it together with it so that you can reduce things like side effects and enhance the effects of chemotherapy. Yeah. Okay, and the myth that's going around, and I'm not sure if you guys have heard anything negative about Echinacea? Anyone? No? Okay, good. Maybe I'll just skip this through. But there has been a bit of issue with things like efficacy and also safety for long-term use. Now, those have all been pretty much been debunked.
What does efficacy mean?
So the effectiveness. Yeah, so a few studies that you might come across, it might say, oh, Echinacea does nothing. Look at these people, we did a clinical trial and it did nothing. When we have a look into those experiments properly, we see that quite often they're not using the right dosage. Sometimes not even the right species of Echinacea, yeah, and different forms that they might use. So those have been really, the studies were designed terribly.
Yeah, flawed.
Yeah, 14 different clinical trials, and it has been proven that Echinacea is, it does reduce the incidence and duration of common colds. So garlic, yes, amazing stuff. I usually suggest to my patients, if they're at home and if they get sick, I tell them to contact me and I'll send them a recipe. It's basically garlic, ginger, honey, and lemon all together, and you just stew it up into this sludgy
You mean you mash it up?
consistency. You just, yeah, and then you just shot it basically, and seriously, it kicks the cold to the curb. It tastes nasty, but does a great job. And because garlic is antibacterial, antifungal, antiparasitic, it's antimicrobial. Yeah, anything that's that might be lurking in your system, it helps to target those things. It's a great antioxidant, and also helps with your heart health and your cholesterol levels as well. And study in 2014 has also proven that people who took garlic every day for 3 months had fewer colds as well.
How would they take it?
You can take it fresh. You can cut it up. The closer to it being the most freshest form, the better. But you also want to increase some of the surface area as well. So the bigger surface area it has, the more it'll affect in your body. So you want to chop it up a bit, yeah, and then just put it into your cooking. But sometimes you can chop up the raw ones and then mix it in with a bit of liquid and shot it.
So you said garlic, ginger,
Honey and lemon.
and lemon.
Yeah,
So lemon as in just lemon juice.
lemon, freshly squeezed lemon.
Yeah. So
Yeah.
just the juice from the lemon.
Yeah.
Okay. Garlic, lemon,
Now.
ginger, and honey.
Now, honorable mentions, and these are by no means any less effective than the ones that I talked about. It's just that I don't have time to talk about every one of them. But Andrographis is what's called king of bitters, and it's amazing for treating acute situations with colds. And it's something that we have in our cupboards as well when I get sick, which is hardly ever. By the
I'm
way.
gonna say do.
Yeah. By the
How's
way.
that
I can't remember the last time I
That
was
looks
sick.
like a mushroom, is it?
Yes, this one is the next one. So Asian mushrooms like cordyceps, kawaratake, reishi, and shiitake mushrooms. A lot of Japanese mushrooms, amazing for your immune system. Okay, I had a girl come in. She was constantly getting sick almost every month for the last, I don't know, 3-4 years. Okay, she's always had chronic issues, always getting bronchitis, pneumonia, all the time. Since she started to come see me, and I gave her this mixture, which we have in our cupboard also for our staff. It's called Super Mushroom Complex. A lot of people think it's a weird other type of mushroom. But for her, she hasn't gotten sick for the last 6 months that she's been with me. And everybody else around her is sick. So she's like, I don't know what's going on. I said, well, your immune system's keeping
Yeah, it's working.
Yeah. So she's doing amazingly, and this product does amazing stuff. Yeah. There's other things like licorice, marshmallow, mullein, and thyme, which is great for your throat, nasal kind of congestion.
Marshmallow?
Marshmallow, yeah. Great for coating your mucus lining and calming it down and soothing it down.
You're not the one
No,
that marshmallows.
not the
buy.
ones that you get from the supermarkets, okay? It's a tincture. It's a tincture, okay? And neither is the licorice, okay? It's not the ones that you're thinking of. No. Got your hopes up, though, didn't I? All right, and things like quercetin and bromelain. Now, bromelain is a type of proteolytic enzyme present in pineapple, which helps to break down mucus. Okay, so together with good fluid intake and things like pineapple, now not too much because it can have a bit of sugar in there, it can help to break down things quite nicely. Horseradish also does the same thing as well. Quercetin is a great antioxidant and anti-inflammatory too. Yeah, works
So
brilliantly for that.
Is that also an enzyme or?
Quercetin is an antioxidant.
And
Yeah.
where do you get quercetin from?
Well, you would get it from fresh fruits and vegetables, but the amount that you would get is a bit low. But for maintenance-wise, it's good to get those foods in so that you prevent yourself from getting sick because you're getting these antioxidants and enzymes. Yeah. Zinc, another one that's very important, and I test this at my clinic. We do a zinc tally test, and if If you taste it and it tastes disgusting, that's a good sign that your zinc levels are doing good. If you don't taste anything and it tastes like water, you probably have depleted your zinc levels. And zinc is involved in so many different chemical pathways in your body, it's not funny. Yeah. It's one of the most important essential minerals to have. So one of the things that's really important is regular exercise. Now I will have to stress this next point though. Studies have proven that excessive exercise, okay, too much CrossFit, too many marathons, all of those things can actually worsen your immune function. Yeah,
Really?
you drive yourself to exhaustion, and we talked about your adrenal function. Yeah, when that starts to deplete, your immune system is gonna plummet. Usually these athletes, they don't particularly look after themselves nutritionally as well, and quite often when I see their blood, not so great. Yeah, so when you don't support yourself doing those things properly, then you can drive your immune system down. However, on the other hand, there's a growing evidence that moderate amounts of exercise, yeah, healthy amount of exercise, is related to decreased upper respiratory infections, yeah, and there's no unfavorable changes to your immune system. So get out there, you know, do some good exercise, but don't drive yourself crazy with it, okay? A lot of people are into this CrossFit thing, doing 6-7 times a week, and yeah, not the best idea. Yeah.
So even if you just walk, it's good.
Oh yeah, absolutely. Just get your blood moving, yeah. Even if you do this, like while you're brushing your teeth. I sometimes do that. I do squats while I'm brushing my teeth, yeah. That's a bit of exercise for the day, yeah. So, you know, little by little, you can definitely incorporate that into your lifestyle. And reduction of stress, yeah. Mindfulness meditation, yeah, very, very useful. And it actually helps some of your immune cells to function much better, yeah. And this quite often is the root cause of the issue, you know, is the stress. Stress causes about 90% of all the diseases out there, 90%, yeah, because it.
I'll be for job, I think.
Yeah, if I can prescribe my patients with like a 6-month holiday to Fiji, I would. But I don't have the money, so I will have to make do with other things that I can do to reduce the stress. Yeah? And mindfulness meditation has so much research. I'm still confused as to why it's not out there to people. Now, one thing I will mention, I have had unsuccessful treatments with people, offering them ways of doing mindfulness meditation, because they feel like they're not doing it properly. Yeah?
There's no right
And
or
this,
wrong way, eh?
and this is the biggest thing that gets people to not continue with meditation, is because they feel like they're not doing it properly. But now, every time I prescribe it to somebody, I always explain right at the beginning, don't worry if the thoughts come into your head. That is completely normal, completely normal. Even some trained Tibetan monks will have some thoughts coming in, but it's not about getting rid of those completely, okay? It's about acknowledging that it's there and not letting it affect you. That is the training of meditation, because that's what you get every single day when you're not meditating, isn't it? You get things flying at you, your thoughts, other people's comments, you know, things flying at you, and it's the emotions that we attach to those things that becomes stressful, right? But if we can just have a look at them and just go past them, oh, yeah, that happened. That's okay. That happened too. That's the end goal that we want to get to. Meditation is that, training your mind how to do that. And so when you have a thought come in, don't get frustrated with it. Just go, oh, it's there. Okay, I'm just going to pop it aside now. Oh, there's another one. And just keep going. And it's a gym workout for your mind. Yeah. So this is a really, really important part of knowing how to do meditation. Yeah. So if there's something to take away today, do some meditation. Yeah, even 10 minutes per day. And if stress causes 90% of disease, I ask you a question: why not do meditation? Yeah. Now, some of the things I do, I'm not going to go on too much about this, but obviously I do a comprehensive naturopathic consultation, so it's 90 minutes long. I discover everything about you.
Oh dear.
Yeah.
I want to discover everything.
Oh, I do, trust me. Now,
You mean about my body.
within that time, I take all sorts of notes, discover what's going on at the root cause, okay? And then I look at your blood as well and combine all that information together and produce you a comprehensive treatment plan, which includes dietary advice, lifestyle advice, as well as supplements and herbal medicines that you want to take, yeah? Informations about those and how to take them as well. So that's all included in that, and usually I catch up with you monthly, yeah, just to see how things are going and seeing what else we need to work on, etc. I also do free discovery sessions. So if you're still not quite sure whether you want to come and see me or not, or if you want to find out more about how I can help you, then I have a free discovery session. So that's 15-minute slot that you can come and talk to me. I can't prescribe you anything at that point, but I can describe to you what I can do for you. And if you feel more comfortable after that, then we can go ahead with the consultation. And I also do acute consultation as well, and not many people know about this. Naturopaths are not really well known for acute situations. We usually deal with chronic things, but we do half an hour acute consultation. So if you do get sick, you can come in for half an hour just to check, you know, medications, what you're allergic to, other things that I need to check just before I prescribe anything, and give you the things that you need. I'm going to finish up now, but I'm going to oh, you know about that. Not many people know about that. Okay, so make a fist. Yeah. And you see this hard part on your chest, that what's called a sternum? Okay. Now you go easy on yourself.
Just tap lightly.
Yeah, tap lightly. Just go 1, 2, 3, 4, 5. Okay. Now if you don't like the fist, you can use your fingers to give a smaller tap as well. All right. Do that throughout the day.
What does
Okay.
that do?
This is what's called thymus tapping, and your thymus is located just behind your sternum, okay? And your thymus holds on to a lot of your healthy immune cells. Now, giving it a good vibration actually helps to release some of those healthy immune cells. This is something free to take away today, yeah? So do this in meditation, you might not need to come back. And this is not something that, say if you are sick, right? If you're already sick, this is not going to help you straight away, okay? This is more for you to do on daily basis so that you can enhance your immune system for free.
Thank you.
All right. So thank you so much for coming. I told you I'll run over time, and I apologize for that, but I hope you guys got something out of it.